Treatment for bunion. What causes bunions? Tight-fitting narrow shoes and heels can cause bunions. A bunion forms. The big toe joint grows in size and protrudes outward. Then over this toe gets tender and red, and bursitis arthritis may occur. Bunions can also develop from foot and sometimes are congenital in nature. Several factors increase your risk of developing bunions. High heels. Wearing high heels can overcrowd your toes and can lead to bunions. Ill-fitting shoes. People, particularly women who wear shoes that are too tight, too narrow, or too pointed are at risk for bunion formation. Arthritis could alter the way you walk and lead to bunions. Heredity. An inherited structural foot defect can cause bunions. What is an adolescent bunion? An adolescent bunion forms at the base of the large toe and affects 10 to 15 years of age. Unlike the teen can move the affected joint normally, but pain wearing certain shoes. Treatment involves having the child's shoes stretched, buying wider size shoes. Surgery is almost always avoided until growth is complete. What is a bunionette? A bunionette is a swollen, painful along the outside of your foot near the base of your small fifth toe, also called a tailor's bunion. Bunionettes have a hard core and painful bursitis. Just like bunions, bunionettes are caused from wearing shoes. In those cases of persistent pain and deformity, surgical correction is necessary. What is the bunions? Treatment. Most bunions are not surgical intervention. If the bunion causes you to have difficulty walking, orthopedic specialists recommend special avoidance of circs, padding and taping, shoe inserts, and/or medications. Changing shoes. The orthopedic specialist recommend comfortable, roomy shoes with adequate space for your toes. These special shoes will conform to your foot shape as well as step, broad toes, and soft soles. Avoiding shoes. Treatment involves avoidance of fitting shoes and high heels. Padding, and your doctor will show tape and pad a foot to hold it into position. These measures reduce stress on the bunion and relieve pain. Shoe inserts. Padded shoe inserts distribute the pressure to reduce your stress. In addition, these devices may prevent your bunion from getting worse. Some people also find relief with the use of over-the-counter supports. Medication. Orthopedic specialist acetaminophen, Tylenol, ibuprofen, Motrin, or naproxen, Aleve, to control bunion pain. Bunion surgery. When your bunion caulking and persistent pain exists, the orthopedic specialist may recommend surgery. Bunions, tendons, ligaments, and nerves sew your big toe is in the correct position. Surgery is done on an outpatient basis using ankle block anesthesia. The reasons for bunion surgery include chronic large toe inflammation and swelling that does not improve with conservative treatment, severe pain that affects walking and everyday activities, toe stiffness, ability to straighten or bend the toe deformity with a drifting end of the big toe. What types of bunion surgeries? Orthopedic specialist surgical approaches to treat bunions. These procedures include thoracentesis. This is the removal of the damaged joint surfaces and insertion of wire screws, or plates to hold the joint together as it heals. This measure is used with severe arthritis. Osteotomy. This procedure involves the cutting and realignment of the joint. Repair of the tendons and ligaments around the big toe, the structures that could be causing the toward the others. This procedure, often combined with an osteotomy, shortens the loose tissue, elongates the tight ones. Exhaustectomy. This technique involves the removal of the bump on the toe joint and is used only when there is no drifting of the large toe. Resection arthroplasty. The orthopedic mostly used for those who have had pre-surgery that failed severe arthritis. What is involved in recovery process? Recovery will be successful if you follow your orthopedic specialist instructions the first 2 weeks following your procedure. Bearing weight. Your doctor will advise you to use cane, crutches, or walker. You will be allowed to wait on your foot as it heals. Dressing care. After surgery, you will have bandages holding your toe in position. Also, you will wear a special suture or cast to protect your foot. The sutures are removed approximately 2 weeks after the procedure. To allow proper healing, you should keep your dress dry and clean. The doctor will advise you on changing the bandages. Swelling and wear. You should keep your foot elevated for the first week following surgery, and ice is recommended to relieve the foot to have 6 months. Exercises. To strengthen your foot, The orthopedic specialist may recommend particular exercises. The doctor could also prescribe a course of physical therapy for you. Medications. The doctor may prescribe antibiotics and pain medications following your procedure. The antibiotics are used to prevent infection. It is important that you follow the instructions and complete this medication.